Let's talk about pleomorphic adenoma and we'll go stepwise. Pleomorphic adenoma is a benign salivary gland tumor. It is the most common benign salivary gland tumor. It arises from the parotid. So remember P for P. It arises from pleomorphic adenoma arises from parotid. The second thing is let's talk about gross. So grossly it is a well encapsulated tumor. How do we remember this? We have a pycnomic here. As you can see, there is a water body and in the center there is an island, and there are two types of groups. They are flag hoisting and here is the flag. So for gross, remember, as this island is encapsulated, so our tumor is also encapsulated and it has this pseudopods. And so in exams they ask you that why do pleomorphic adenoma recur? So the answer for that is the pseudopods. It has pseudopods, so even after removal there is a chance of recurrence for pleomorphic adenoma. So after gross, let's go to microscopy. So as I said, there are two groups of people here and there is a water body. The water body is the chondromyxoid stroma, which we see on microscopy. So the chondromyxoid stroma, one type of people are the ductal cells. Okay, the second type of people are the myoepithelial cells, which are compressed cells. And the third thing is our ocean or the water, which is the chondromyxoid stroma. So there are three important things in morphology. One are the ductular cells, the second is the myoepithelial cells, and third is the water body. Okay, so two groups of cells and the water body. Two groups of cells and the chondromyxoid stroma. The same thing you can see on high part. These are the ductular cells and these are the myoepithelial cells which are compressed. And here we have the stroma. Also, if you see like this island can also be called as a cartilage. So seeing cartilage in the microscopy of pleomorphic adenoma is common. So if you see cartilage on microscopy, first think of pleomorphic adenoma. Okay, now let's move ahead. On cytology, this chondromyxoid stroma gives this fibrillar appearance. Especially on diff-quick, it appears as metachromatic fibrillar structure, which is seen like troll hair. So this is a cartoon and his hair looks somewhat like this, and it is the same thing the way chondromyxoid stroma appears on cytology. So that is important to remember, the troll hair. Now coming to the most important, that is the cytogenetics, how to remember. So as you can see, I already said that there are two groups of people who are singing the national anthem when they are flag hoisting. So one group of people are humming. As you can see, their eyes are closed and they're humming. The second group of people are singing. And for singing in Hindi, we say ga. Okay, ga. So when we join this together, it is HMGA2. So this is one cytogenetic abnormality which is seen in pleomorphic adenoma. The second is here, the flag for PLAG1. So these two are the most characteristic and very common cytogenetic abnormality in pleomorphic adenoma. Alright, so now let's revise pleomorphic adenoma. So to begin with, pleomorphic adenoma is the most common benign salivary gland tumor. It occurs more commonly in the parotid gland, so P for P. Then going to the gross, it is very well encapsulated and it has pseudopods because of which it can recur. Then when we go to the microscopy, there are three important structures. One is the ductular cells, one is the myoepithelial cells. So these two are, one is the ductular cells, one is the myoepithelial cells, and the ocean here is the chondromyxoid stroma. Alright, then we have troll-like hair. So to these characters, we are drawing troll-like hair. So to remember that on cytology, quick stain gives a fibrillar appearance, metachromatic appearance to the stroma. And now they look like females. And therefore, pleomorphic adenoma is more common in females, unlike Warthin's tumor, which is more common in males. So that's it. And yes, the most important thing is the cytogenetics. So remember, for flag, PLAG1, and GA, that is HMGA2, is for the second cytogenetic abnormality in pleomorphic adenoma. So that's it.